Take one.
Hi, I'm Sylvia Gordon with Gordon Marketing. We work with thousands and thousands of clients across the country. We work with thousands of insurance agents. And Medicare Part D is extremely confusing and frustrating. How do you pick your drug plan? The easy answer is buy the cheapest plan in your area. But of course, the cheapest is never the go-to easiest. And you know, you've been around long enough, you're at least 65 if you're watching this video, you know that many times the cheapest is actually the most expensive. That's one of the things I'm trying to teach my teenagers. If you buy the cheap one and it breaks and you end up buying 3, the cheap one really wasn't the most expensive. It's not necessarily true with Medicare Part D because sometimes the cheapest drug plan is the cheapest drug plan. The lowest price will cost you the least amount over the course of a year. But it's not always that simple. What your drugs are going to cost you if you're already taking drugs is a different equation than if you come to me and you say, hey, I'm on 2 drugs right now. Well, that's easy. That's easy. But a lot of people change. And so you're on 2 drugs right now, your plan will not be able to be changed for a year in most cases. And when you have a problem arise and you're sick, now it's completely different. So people say, I don't really care about the drugs, give me the cheapest one because I'm not taking any drugs. You don't really need insurance, you don't care about insurance unless you're sick. And when you're sick, now you're going to want to be on a really good drug plan. You're going to be on one that has a big list of drugs. We call that a formulary. Some drug plans are really cheap, they're inexpensive. They also have a commensurately
Take 2.
A plan that's really inexpensive might have, and usually does, a really small list of drugs that they cover. Well, you don't care when you first sign up. You're like, it's cheap, I take 2 drugs, we're good. I don't like to do that as an agent because if you can afford to have a plan with a bigger formulary and it might only cost you a little bit more a month, that's what you want. Insurance isn't about right now. Insurance is about what if I get cancer 6 months from now and I'm taking a lot of expensive drugs and none of them are going to be covered or the copays are much higher. So a good agent is just not going to just be like, boom, boom, get out the door on the Part D. Part D is frustrating for you. It's also frustrating for your agents because insurance agents don't get paid a lot of money on it. It takes a lot of time. They get impatient with it. A good agent knows it's the most important part of getting ready to retire. It's not understanding your Medicare Part B. It's not understanding your Medicare supplement or your Med Advantage. It's understanding the drug component. Because drugs will be the most expensive part of most people's budget, not your premiums that you're paying for your other health plans. And the drugs you're taking now might have no relation to the drugs you're taking even a month from now. So don't take the shortcut, don't take the easy way out by just going to the website or talking to one agent and saying, just give me whatever's the cheapest, I don't take any drugs. Actually think about if you got sick, could you afford to pay for all your drugs? Could you afford to pay a lot more for all your drugs? What's your family history like? What's your budget like? You know a lot about your health history. You know things that your doctors talk to you that you're maybe watching or things that's going on in your family. So it's not an easy equation. Talk to a good agent and he or she will help you with Medicare Part D.